Chapter 13, Making It in Midlife. This chapter sure hits home to me because this is exactly where I am at. And I'm going to start with our Wisdom of the Wolves this week because there's some quotes about change that are so appropriate. Robert Burns says, nature's mighty law is change. And then a couple food for thought quotes. James Baldwin says, not everything that is faced can be changed, but nothing can be changed until it is faced. And then Roy Blitzer said, and I think you probably all have heard this quote, the only person that likes change is a wet baby. So we're going to be talking about changes. We're going to be talking about grandchildren because that's all a part of this chapter. And towards the end, I'll explain why I'm videotaping this in the room that I am. Some physical changes that I can identify with in middle age include wrinkles, gray hair, of course. When it comes to women and gray hair, only her hairdresser knows for sure. And that's a double standard because when women get gray hair, they look old. When a man gets gray hair, he looks distinguished. And then weight gain. And with weight gain in women, often when they get older, they panic and they think, oh my gosh, I'm gaining a few pounds. I need to go on a diet. So they go on a diet, which, by the way, is a 4-letter word. Not a good thing. They end up gaining more weight than they started out before they wanted to lose it. So just accepting these changes is the best thing. Male pattern baldness. For you men, you have to look at your mother's brothers or mother's father to know what your hair pattern is like because it is a sex-linked characteristic on the mother's sides for most men. Culture and gender are two of the things that we need to think about when we think about physical changes. Many times you'll see a 60-year-old who really looks 50, and then the next time you'll see a 50-year-old who looks more like they're 60. So if you did not know how old you were, how old would you be? I think a lot of it's frame of mind, and we can do a lot of things to keep ourselves from looking older in the way of keeping ourselves healthier. So we'll be looking at that in this chapter. Some changes in bones and joints. For women, especially when she's about 50, her doctor probably will have her do a bone scan, a DXA. I'm a classic example of somebody who is at risk for osteoporosis, and I am at osteopenia, just barely into that range, and I'm doing everything I can to keep from developing osteoporosis. So those bone scans can be a good thing because they help you know where you are. There's medications, there's more calcium and vitamin D that we should be taking, weight-bearing exercises, lots of things like that that can help prevent osteoporosis. Starting at about age 20, we can develop arthritis. There's two different types. There's osteoarthritis and rheumatoid. Osteo is when you start in your 20s, you lose the protective cartilage in the joint, and then also bone can decrease. It's just a wear and tear kind of disease. So this probably would explain why my husband has just had to have his hip replaced. He's only 67, but through years of wear and tear on his bone, and when we saw the picture of it, it just was bone against bone. So fortunately, with medicine today and surgeries, hopefully as soon as my husband gets back to 100%, he will feel more like he's 40 or 50 instead of almost 70. We're hoping that's the case. Rheumatoid arthritis can happen at a much younger age. It's a more destructive disease of the joint. Some reproductive changes that can happen in midlife. A climacteric, it's a gradual lessening. For women, it's called menopause. It can begin in their 40s and then end in their 50s. Basically, a gradual lessening of their ability to reproduce. Some symptoms, hot flashes, night sweats, headaches, mood changes. Many of you maybe have seen that in your own mothers or grandmothers. The woman may notice she has difficulty concentrating, vaginal dryness, her cholesterol levels, those HDLs and LDLs that we've learned about, can change. And so there are some things that women can do besides exercise. There are some homeopathic kinds of things. There's also hormone replacement therapy, although that's very controversial because there are some risks involved with that. I hope by the time most of you go through menopause that they will find something that can be helpful without all of the risks. For men, reproductive changes are less dramatic. Some things that might be of concern would be prostate cancer. Men do experience some physiological changes, less perceived demand to ejaculate, a need for more time and stimulation to achieve that erection orgasm. Of course, that can be positive because women need more time as well. A much longer resolution phase, that's the ending phase where he returns back to normal. The advent of Viagra and other medications has been very helpful in this area. We're going to learn about stress and health. Stress is a physiological response. For men, it can be fight or flight. For women, it's more of a tend and befriend. So you're going to learn about the stress and coping paradigm. Coping refers to our attempts to deal with that stress. And so we need to learn those coping skills. Stress can affect our physical health, and so we need to learn how to manage it well. Exercise, aerobic exercise, basically you exercise to 60 to 90% of your maximum heart rate, and they suggest that we do this 150 minutes per week. That's basically 30 minutes a day for 5 days a week. So if you can make exercise a priority, that can be very, very helpful. Cognitive development is addressed in this chapter. Our practical intelligence is the broad range of skills related to how individuals shape, select, and adapt to their physical and social environment. And there's a lot of adapting, a lot of changing that goes on in midlife. You're going to learn about the mechanics and pragmatics of intelligence. The mechanics is more directly an expression of the neurophysiological architecture of the mind. And then the pragmatics of intelligence is associated more with the body's knowledge that's available from and mediated through your culture. Becoming an expert, we all are probably an expert at something by the time we get to be midlife, so we need to capitalize on those areas of expertise. Lifelong learning. Online learning has made that more accessible to professionals and interested adults alike. College campuses are an obvious place for lifelong learning, but it doesn't have to be on a college campus. Many organizations offer workshops, even TV. Being retired now, I'm maybe watching a little more TV. Today we were watching the Britain English baking series, and so that was interesting. There's home building, home makeover programs that are interesting to see how they take these homes and can really change them. We've talked in the past about how one must teach adults differently than younger adults and even children. This is why I have said that my older students are often my better students, because they know why they want to learn. They have a true reason for learning. They also can capitalize on their experiences. This chapter talks about personality. You're going to learn about the 5-factor trait model, and as you learn about that, think about where you fit in with your personality. Priorities change. I didn't have to retire. I could have continued working, but with my husband having been retired a few years prior to me, he was ready for me to retire, and we knew we wanted to move to be closer to our grandchildren and then closer to medical care with his need to have his hip replaced. So those were two factors in our decision for me to retire. And I can tell you that I certainly have enjoyed that, and I think it's great because now I get the best of both worlds, because I not only get to be closer to those grandchildren, spend time being a grandparent, but I also still get to teach. Other family dynamics, I probably am known as the kin keeper, as you're going to learn about in this book. The mother, middle-aged mother, who works hard to keep their family together, works hard to provide those celebrations, those opportunities to spend time together as families. And I don't only do that for my children, but I also do that for my siblings and my husband's siblings. We're wanting to host Christmas here, and I work hard to keep my siblings together when we're in Colorado. Probably part of that comes from being the oldest of those 4 children. People in my age range want to give back to the community, give back maybe if they still have aging parents, and even younger children want to give back to their parents who are aging. So you're going to be learning about that. And the last topic in this chapter is on grandparenting. Grandparents use different styles of grandparenting with different grandchildren. I see that already just because of the ages. Styles tend to do that. They vary with the age. The reason that I chose to be in my grandmother's playroom in our home, I set this room up for my grandchildren. You can see there's a rocking horse in the background. There's a rocking chair. There's some stuffed animals in the books that we had when our children were growing up. You can see I have some family pictures. And then over here is a dollhouse that my husband made when our daughter was small, and so we have it in our home. And it's amazing how our grandsons like to play with that. I hope someday to have a granddaughter, but if not, the grandsons can enjoy it. And then over here, I'm actually laying on the floor. This was really kind of comfortable. I enjoy being on the floor. Over here we have some toys for the grandsons. In fact, my 3-year-old, the first thing he comes is dumping out all of those baskets, and then we have a huge mess. But he's learned that he needs to clean that mess up, and so we spend time cleaning up. We make it a game and see who can pick up the most toys the fastest. And they may not end in the right basket, but that's okay. They're picked up and are off the floor. Well, I hope you enjoy this chapter as much as I have this week. Thank you and have a great day.